See you then, John. Thanks.
Let's get more now on the announced plans by the government to step up efforts to recover money from so-called health tourists, overseas patients who use the NHS in England. From April, there will be a legal duty on hospitals to ask visitors to pay for non-urgent care up front if they don't qualify for free treatment. The total cost of overseas visitors being treated by the NHS in England is estimated at around £2 billion a year. Meanwhile, the Health Secretary Jeremy Hunt has aimed at recovering £500 million a year by the middle of this Parliament. However, figures released last year showed that the government is set to fall short of its target by £150 million. With me in the studio is Vivek Kotecha from the health think tank, the Centre for Health and the Public Interest, and Saffron Caudry, who's the Director of Policy and Strategy at NHS Providers. She joins me from our central London studios. Thank you both for coming in. Vivek Kotecha first, what's the evidence so far about how successful the NHS is in getting this money back?
So it varies. For residents outside of the European Economic Area, they estimate in 2012 that it was about 65% of the outstanding debt was collected and invoiced. In the EU, of EU countries, it's about 16%. So there's a huge gap in collecting EU, in particular EU residents, kind of shortfalls, even though in theory it should be easier, given we are part of a European health insurance scheme, and at the moment at least.
At the moment. So what happens after Brexit?
So after Brexit, if we don't have these same agreements in place and we don't utilise them, there is a risk that we're going to end up footing quite large bills to prepare this administration and to cost and bill all these citizens in this country.
Yeah. Saffron, I'm just wondering why some NHS trusts seem to be better at getting money from these health tourists than others.
I think it's thinking about how we collect this income from those who visit the NHS from overseas. I think it's really important to think about the practical arrangements that need to be in place to do this. We know that in some areas, for example in Peterborough, they're running a pilot to look at eligibility for overseas healthcare and then collecting that money up front, and we know that that's been going very well. However, what we've got to make sure is that we've got the infrastructure in place to be able to do that. And at a time of unprecedented pressure on the NHS, we need to think about where we actually focus our efforts. It's very, very important that we collect any income for the NHS, but we've got to put this into perspective. What we're actually talking about is collecting an extra £211 million a year, which is actually only 0.18 of the total NHS budget. So what we're thinking about here is something which is important. It's very important to make sure that everyone pays for the treatment that they have from the NHS, but we've also got to make sure that we put it in perspective.
But are we facing a future where people turn up with ID and a credit card and they won't get treated unless they produce both?
I'm not sure what the arrangements will be in future. I think that we're facing a situation where those who are visiting the NHS for treatment from overseas will certainly need to be able to prove that they are eligible for treatment and that they are able to pay for it. But what we've got to remember that this is about elective care. It isn't about people in an emergency turning up and needing treatment. That will always be available, whoever the people are. So I think we've got to really put this in perspective and keep a focus on what we're talking about. We're talking about collecting a very small percentage of the NHS's overall budget. So we need to make sure the right systems and processes are in place, but we also need to make sure that we aren't putting in overly bureaucratic measures that cost more money than they collect.
So, Vivek, when we're talking about the cost effectiveness of measures like this, one thing we are all aware much more of is the pressure that the social bill is putting on the NHS and finances. So, what can the government do to maybe find money there?
So I think one of the key things that when we look at social care is, firstly, there's a lot of pressure on people getting a GP appointment. That then puts pressure on the hospital bed system. We have one of the lowest levels of hospital beds per 1,000 people out of the OECD. We have about 2.73 hospital beds per 1,000. Say Germany has around 8, Russia has around 7, most of the OECD has around 4. We've been losing per 1,000 people hospital beds over time. And at the same time, within the social care sector, The other issue is there's a very high rate of return or profit being made by private equity-backed ones, which is about 20% of the beds. They make on average about 12% profit is what their rate of return, their target is. That's taking a lot of money out of the NHS. If we could reduce that to 5%, say through more government investment in it, because it is quite a low risk, low return business, we could save, they estimate, around £99 per bed per week in social care, and that could fund a lot more places.
Saffron Caudry, the pressure on families to take responsibility is something that only recently the Care Minister David Mount was talking about, saying that actually families should take their parents into hospital and make sure that they've got somewhere to come out and stay afterwards, and that would ease an awful lot of the pressure. Are we passing the buck too much to government?
I think what we've got to look at is the whole system that's operating in health and social care at the moment, and we've got to look at every element, and we've got to make sure that it's equally weighted. I think what we have to remember is that as a country per capita we spend 30% less on health and care than a country, say, like Germany does at the moment. So we've got to look at the level of investment we put in health and care. We've also got to look at how we actually run the health and care system. So it isn't just about whether families are doing their bit. Of course, families need to do their bit, but it's about whether every part of the system is working properly. And we know that the money has been taken out of social care and local authorities and hasn't been replaced with anything that could put an effective social care system in place. So I think that, you know, the social care system is very substantially challenged at the moment, and I think it's about every part of what makes up the mosaic of health and social care provision playing its part rather than focusing on one element.
And Vivek, it's not just about throwing money at a problem, is it? It's the way the NHS actually works and the waste that there still is.
Yes, there is. I feel there's, at least in the social care sector, there is leakage out of via tax avoidance and other profit making, which you could
explain that tax avoidance.
So a lot of the larger groups are structured in ways to minimise their tax burden. So in a sense, it's money going out of the NHS or out of the health and social care system. Within the NHS, there are other things. So this £500 million target, to put it in perspective, we spent last year, the NHS spent £4.1 billion on temporary agency staff. It spent £433 million on management consultancy contracts. I feel like focusing on those areas would be in some way a lot better value for money in terms of the money you'd get out for the money you invest in than, say, trying to work out who is an ordinary resident and entitled to NHS services across the country. I feel in some hospitals that is important, especially when they have a lot of tourists or foreign visitors in those areas. But generally, as was said by the NHS providers, it is a case about being sensible about where we focus this limited money. We have a £54 billion cumulative funding gap in the NHS up to 2021. So we need to spend every penny carefully and make sure that we're getting the most out of each pound we spend.
Saffron Caudry, I mean, does that chime with you, that this whole issue of efficiency?
Yeah, I think that what Vivek has just said is absolutely spot on, and hospital trusts up and down the country are working very, very hard to cut things like agency costs. And I think, you know, there is a question about efficiency in the NHS, but it isn't about the efficiency of how trusts are running. It's about the efficiency of how whole local systems are running, and health and social care being invested in and working more closely together will give us much greater flow through the hospital system and out into social care, and will enable us to use things like operating theatres to full capacity. We'll make sure that we reduce things like cancelled operations, and we'll also make sure that we are running the NHS at a capacity which is safer. So we've talked about, you know, bed occupancy rates needing to be at 85% rather than the 90 or 95% that they're currently running at. So yes, that certainly chimes with what our hospital trusts are telling us.
Well, Saffron Caudry, thank you very much for your time. Vivek, Kotecha, thank you too. Thank you.
In a moment, a summary of the business news this hour. First, though, the headlines here on BBC News. And the NHS is under pressure. 9 out of 10 hospitals have been dangerously overcrowded this winter.
Stefano Brizzi, a killer who strangled a police officer and tried to dissolve his body in acid, has died in prison.
President Trump steps up his attacks on a judge who overturned his travel ban on 7 Muslim-majority countries.
Hello, I'm Vishana Sripathman. In the business news today, Apple, Facebook, Google and Microsoft have filed an official court document opposing Donald Trump's travel ban. The US President's executive order